Welcome to Gut Savior with Dr. Sal. There are many phases of bloating, but we should try to take this bloat out of the bloating diagnosis. So the diagnosis of bloating is a symptom. It is not a diagnosis. It is a symptom for many diagnoses. So let's look at the causes of bloating today. So there are many causes, from very simple explanation to a little difficult explanation. So let's begin with a simple case. Have you heard of aerophagia? What is aerophagia? Aerophagia means eating. Many people don't know, but their mouth breathe. So what happens is if you breathe through the mouth a lot, either because your nasal passages are congested or you have adenoids or something which are hyper, then you start eating air. Where does this air go? It either has to pass through the bottom in the gas form or you have to burp it out. If you don't do either, you get bloating. It is fascinating to see that when children have this a lot, they tend to eat air. So what happens is that at bedtime, when they're going to bed, the belly is big, but in the morning it is flat. That's one way we diagnose it, that it is aerophagia. So that is the simplest explanation. Again, people who smoke cigarettes, they suck in a lot of air. If you are always used to drinking with straws, sometimes you suck in air. If you chew gums a lot, you're gonna suck in it. That's your aerophagia. So that's the simplest explanation of bloating. But there are many causes, right? So sometimes you can have, as we know, symptoms of bloating can be because of celiac disease. Celiac disease is a problem with gluten. Gluten is where? In the wheat, the rye, the barley. If you're having problems, you need to get checked out. You know, it's a simple blood test. We call it anti-TTG antibody testing. Get the simple blood test drawn, and then along with this, usually we send the serum IgA levels to know that if you have normal IgA levels, you can rely on this antibody. And this test alone will tell you if your numbers they should be less than 19 units. But if they are very elevated, more than that, it can go up to 200 or more. If it's elevated anywhere above 19, then ideally you should get an endoscopy done, camera through your mouth into the stomach and the small bowel, and that endoscopy will tell you that you have celiac disease. What happens in celiac disease? So celiac disease, I'm drawing a schema here with this is your stomach, this is your small bowel, the duodenum. The scope will go from here, from your mouth into the small bowel, and then it'll take tiny samples from here, and I will enlarge this part. And in this, when the pathologist looks at it, in celiac disease, you have blunting of the villi. What that means is typically in an ideal situation, you have very long gracile structures in your small bowel lining that absorbs all the nutrients as they are passing through. In celiac disease, what happens is this is normal, and in celiac disease, they are blunted, they are broken. So you don't have enough of nice villi, which is absorbing all your nutrients. You start losing nutrients. That's why in celiac disease, sometimes you can have nutrient deficiencies. Kids may not grow well. When you look at their growth charts, their height starts faltering. They don't reach their maximum height. Very important to diagnose early in children, so their bones are not fused and they are diagnosed before then. And the treatment is go gluten-free diet. You go gluten-free diet, however, it is for the whole life. But if you do that, these villi again become normal, and you start absorbing nutrients. Kids start getting taller, they get their potential height. So with gluten-free diet is the treatment for this. It is interesting to note that people with celiac disease, yes, it's a misfortune, but those who have celiac and they go on a gluten-free diet, on an average, they live 10 years longer than average people. So in some ways, it's a blessing in disguise. Gluten-free diet, maybe because it's less processed, has something good to it. If, however, you have celiac disease and you don't treat it with gluten-free diet, you have higher risks of bone loss, osteopenia, osteoporosis, and some other conditions, serious conditions, like lymphomas. So that's about the celiac disease diagnosis. However, there may be conditions which are called, so celiac disease is of course one of the reasons why you can have bloating and gas. And so that is one of the reasons. Some people have gluten sensitivity. They don't have celiac disease. Unfortunately, there is no diagnostic strategy or investigation you can do to diagnose this condition of gluten sensitivity. So gluten sensitivity, there is no test for it yet. We call it now non-celiac gluten sensitivity. Some doctors don't even believe that this is a real diagnosis. However, there are patients who go on gluten-free diet and feel much better. It may overlap with inflammatory bowel disease. With irritable bowel syndrome. Not with inflammatory bowel, with irritable bowel syndrome. It may overlap with this. IBS is also a condition where you can have bloating because you're not tolerating fermented food as well. So you have to then try out low FODMAP diet in these conditions and see if you go low FODMAP diet, which are less fermentable sugars or carbohydrates, then your condition may start improving. So that's one of the ways we deal with these conditions. So as you see, that celiac, gluten sensitivity, irritable bowels, aerophagia, these are the causes that we discussed so far. What about other things? If you have bloating symptoms, you can have leaky gut. So typically the gut is very, very strong in the sense that it is not very permeable. It does not allow things. It's the first line of defense. Imagine your gut is the only organ that's connected on both ends, from mouth to anus. Both sides are open to environment. So it is battling a lot of stuff through the food, through the environment, through whatever we put in our mouth. It is dealing with it, and it has to make sure that it lets the right things in and the wrong things out. So that is the permeability factor. So what happens is, yes, you may have a little bit of gap junctions in your gut through which it lets some of the things in. That is a permeability factor. So there is a little leak going on always in your gut. But when we call leaky gut, which means there is a lot of stuff coming in which should not be coming in. And that happens when our gut microbiome, which is collection of bacteria, virus, and fungi, which are in our gut, and there are 100 trillions of them. 100 trillions of them. They are disturbed, they are not healthy, and they are damaged. The condition called dysbiosis. When dysbiosis happens, leaky gut can happen because these good bacteria are not able to stop the harmful bacteria with their harmful contents from getting inside our body. Also, what happens that with leaky gut, many times you may have associated digestions and you may have abnormality in the digestion. So you are not able to get your fiber and other products that you need, the prebiotics, handled efficiently. So you're going to create a lot of air in such situations. These are associated with malabsorptions. Malabsorption, which means you can be malabsorbing lactose or other sugars like fructose and other conditions like glucose. Typically lactose and fructose, they are affected, and of course the sucrose. So you have malabsorption of these going on in the small bowel, and when it gets to the large bowel, the bacteria are acting on it and fermenting them and producing air. That air leads to bloating. Other condition you can have associated with leaky gut is SIBO, or small intestinal bacterial overgrowth. When you have small intestinal bacterial overgrowth, it means that in the small bowel, typically you should not have large number of bacteria, because large number of bacteria are mostly seen in the colon, the large bowel. So colon has a large amount of bacteria, but if your small bowel has large number of bacteria, you're going to have severe bloating. Why? Because in the small bowel, you don't have enough room for the air to expand. Colon can expand, right? But the small bowel cannot. So that stretching of the small bowel is going to lead with severe bloating symptoms. That is the small intestinal bacterial overgrowth. Leaky gut means that you need a lot of good bacteria in your diet. So the probiotics can actually help you in this condition. You have to be careful what kind of probiotics you're using, and read carefully when you read about probiotics. Look at the kind of bacteria there are. You want to look at Lactobacillus acidophilus, Lactobacillus GG rhamnosus. They have been extensively studied and have been found to have some benefits. Although some people argue that the benefits are not grade A quality based on the research studies. They're not high quality research, but they still show some benefit. Other good bacteria or the probiotics are Bifidobacterium and Streptococcus. So you can have these bacteria and you read about it, Strep thermophilus and Lactobacillus casei, Lactobacillus acidophilus, Lactobacillus rhamnosus GG. And there are many products, they have these in them. So you can pick and choose and then look at the data. Some research has shown which ones are beneficial, and then you take them but it is a temporary measure. You cannot afford to take this forever and ever. First, because we don't know. There is no data to show long-term use can do what benefits or what harms. It's not been studied for long-term cases. For short-term, but eventually you'll have to come to the probiotic diet, okay? So there is where you have sourdough bread, you have yogurt with live cultures. When you get a container of yogurt from the store, from the pharmacy, from the grocery store, just read behind it. It'll say live cultures, and that'll name the same Lactobacillus so-and-so, Casei and Paracasei, or Lactobacillus acidophilus. It'll name these. So you can have those, the yogurt, you can have kefir, kimchi, the pickles that you can make at home with water and salt only. Don't put vinegar. Make your own pickles at home. Put some water, put some salt, and then find the vegetables that you like. These will give you some probiotics long term. You cannot rely on commercial probiotics for a very long time. Then eventually you need prebiotics. Prebiotics are what your gut bacteria is asking for. These 100 trillion little babies, the bacteria that you're carrying with you, they are asking for prebiotics. Prebiotics are soluble fiber mostly. And they are in so many food items that we have. But you have to have those in your diet. The seeds, the nuts, the lentils, and the garlic, the onion. But remember, if you have bloating, the same contents like onions and garlics can be bad for you for bloating because they are high FODMAP also. So when you're going on low FODMAP diet for a few weeks, you may have to avoid those things like onion and garlic to get rid of the bloating initially. So these are some nuances that the bloating has, but it's easy to understand now. You have leaky gut. This can be treated with antibiotics. SIBO can be treated with antibiotics. But for leaky gut, you have a probiotics and prebiotic treatment. For SIBO, if you have small intestinal bacterial overgrowth, you may need antibiotics initially, like Flagyl or metronidazole, to help you eradicate those extra bacteria. And then once they're gone, then you come back to your regular high probiotic prebiotic diet. Now, as we were talking about other causes of bloating, sometimes you have to understand that there can be some reasons which are non-conventional or which are not easily diagnosed and not very common, but they are there. So if your bloating is not going away, no matter what you do, you've tried diet, you've tried prebiotics, you've tried probiotics, you have tried to identify SIBO remember, SIBO can be diagnosed with lactulose breath test. So this is they calculate the amount of hydrogen that's secreted in your breath, because when the bloating happens, when the gas is excessive, eventually it will go to the bloodstream, come out of the breath, and that is where they measure the hydrogen in the breath, and it's written as parts per million, how many parts per million. If this test is not available, there is an indirect way too. You go and ask your doctor for lactose hydrogen test, lactose breath test. This test will not only diagnose you with lactose intolerance. If you have lactose intolerance, that can also be a reason for bloating, by the way. But if the results are showing that hydrogen is elevated in your breath initially, because in lactose intolerance, you will have slow elevation, like 5, 10, 20, 50 parts per million, and finally 100. That means as the lactose intolerant, as you're not absorbing lactose, you're creating more and more hydrogen as it passes through your gut. However, if you have high quantity of bacteria, which is SIBO, you're going to start producing hydrogen early on. So you're starting with 25 or 50 and going up to 100 and 150. Like initially you are having so much of hydrogen produced. That is an indirect way of knowing you have SIBO. But there are very few tests out there that can actually measure it. But if there is a high index of suspicion that you have SIBO, your doctor may prescribe you Flagyl or other antibiotics to deal with this condition. Now, there are, as I said, the rare conditions. Like sometimes if you have gastrointestinal symptoms which are not explained by any of these. Okay, you have bloating, but you also have diarrhea, constipation, you can have cramping, and you have these symptoms that behave like IBS. But management of IBS is also not getting rid of your bloating. Then you are dealing with maybe a condition where your mast cells in your body are activated. So there is a condition, mast cell gastroenteritis. We sometimes find it when we do the endoscopy and colonoscopy and biopsy. So in the stomach and in the small bowel, when we take samples, there are high number of mast cells, more than 20, more than 40 in high power field, which is every field that under the microscope that your pathologist is looking at. If you have such high number of mast cells, then those may be giving you the symptoms. Now, what are these mast cells? They're immune cells, like they'll go up in infection and allergies. But if you don't have any obvious allergies to explain, but you are having these GI symptoms and the endoscopy reveals these mast cells, then that may be an explanation for your bloating as well. So here, the treatment is different. Now, in this case, these mast cells are releasing histamines, tryptase, prostaglandins, leukotrienes, all these things which are creating allergies kind of symptoms, but there is no trigger or no apparent trigger. Why are their mast cells getting activated? It may be part of the broader mast cell activation disorders, MCAD, or mast cell activation syndrome. In these cases where you have hyperactive mast cells or mastocytosis, which mast cells are everywhere, not just in the gut, then you may have all sorts of other symptoms. Allergies, from nasal allergies to skin rashes to urticaria, we call it, like hives everywhere. You may have fatigue, brain fog, you may have respiratory issues, palpitations, other conditions, dropping blood pressure, dizziness, fainting. That's all. If you're having all of these kind of things, you may be having mast cell activation syndrome. And mast cell gastroenteritis is a small part of it where it gives you GI symptoms. If mast cells are high in upper GI, which means in your stomach and upper small bowel, you may have nausea, you may have bloating. If it's in the mid part, then you can have bloating, cramping, lower part, diarrhea. So then it behaves like irritable bowel syndrome. So IBS is tricky. IBS diagnosis, there is a way to diagnose it, but you have to have a very good gastroenterologist who works with you and does not label you after a 15-minute conversation with you. If a gastroenterologist tells you it is IBS, I would be leery to go that fast with the IBS diagnosis. You have to make sure you are ruling out several things here which behave like IBS. Or if you make a diagnosis of IBS and things are not improving, then challenge that diagnosis. I would do that. So here is the histamines are secreted in your body by these mast cells. So what do you need? You need antihistamine. You have cetirizine or Zyrtec and other antihistamines, but the best way to do it is also that will stop the H1 receptor. Okay, histamine receptors, but histamine receptors are several different kinds. You have H2 also. These are responsible for acid secretion in your stomach. So ideally you use H1 plus H2, trying to block as much histamine as possible. If you do that, like a combination of famotidine and Zyrtec, you may start feeling different and your symptoms may start improving. That's a poor man's or a poor doctor's way of diagnosing. If we were in a rural area where there's no advanced facility, this would be a best way to test it out. A trial that may succeed that this may be mast cell related. But then sometimes you need stronger stuff. You need mast cell stabilizing drugs, which are like cromolyn sodium, sometimes all the way to leukotriene inhibitors, prostaglandin inhibitors, low dose of aspirin and leukotriene inhibitors, which are available commercially, can help you with these kind of symptoms. And you may start noticing that as you are containing these mast cells from getting hyperactive, for whatever reason, your symptoms have improved. The global symptoms may improve. The brain fog, the dizziness, all that other conditions, systemic conditions may also start improve. So that is something to also note. So today you learned a lot about bloating. So bloating can be simple aerophagia to so much of other things, but these can all be diagnosed. They can be treated. A healthy, good diet with a good soluble and insoluble fiber in your diet. But remember, bloating can get get worse if you are taking fermentable food items. So just jumping on the bandwagon at, okay, I'm eating good probiotics, prebiotics. But remember, these prebiotics in the early stages of IBS, in your bloating phases, the same garlic and onion, which are good prebiotics for you, can be detrimental in early stages of bloating. So first you have to find out where you are. And a good gastroenterologist will walk you through this diagnosis so you don't end up experimenting for years. That is the problem I see over and over here. People are experimenting, and wasting months and months and years. And a large number of them also spend a lot of money in testing. There are no magical tests out there for many things, but there are some crucial, very essential tests which are easily available, and people are not getting them done from their doctor. And the doctors are not advocating them as proactively as they should. So this is something that I want you to remember. Next time we'll tackle some other issues, but today was taking the bloat out of the bloating. Thank you for joining me. This is Dr. Sal from Gut Savior. Visit my website, gutsavior.co, for more information and the ways I can help you.